Welcome back to the Overthinking Podcast, the show where we quiet all the fitness chaos in your brain so you can finally make sense of it. Today, we're joined by someone who works on the front lines of one of the most important areas in women's health: our relationship with food, exercise, and our bodies.
Dr. Maddy Palermo is a clinical psychologist with a PhD who works in the eating disorder unit at Rady's Children's Hospital. She has performed research on the risk factors that lead to disordered eating behaviors and how to prevent them. Oh, and full disclosure, Maddy is also a client of mine
Whoop, whoop.
and has been on her own personal journey to finding freedom from the constraints of restriction, so she walks the walk.
And talks the talk. And we have some little questions for you. We want to know a
Little
little bit,
icebreaker.
a little icebreaker moment, because we want to know who Maddie is outside of the clinical setting too. So, do you have any like hobbies or obsessions, or like who is Weekend Maddie? Like, what is your alter ego?
Yeah, so Weekend Maddie it's funny because I have such a strange work schedule. I work every single Saturday, so my Sundays are sacred.
Mm.
Weekend Maddie prioritizes Sundays like nobody else. So the things I love to do are very like hashtag San Diego. I'm always at the beach. If I don't see waves like once a week, I feel like I'm not myself. I love my hot girl walks on the beach and just like dolphin watching. Not successfully most of the time, but alas, I try every time. And then I feel like if I'm not at the beach or doing yoga, I'm always just like diving into a new read. I'm a big
Ooh.
reader. I was
You're a
actually
big
super
fantasy girl.
yeah,
We
yeah.
talk about that a lot.
Yes, I can talk books for days, and I feel like I kind of hyperfixate on the little worlds. So any book I'm in, I'm in it. And I'm like, if I finish it, I want to go on Reddit and read the theories and really get into
Oh.
it. So I'm like, those are some of my faves for sure.
So it sounds like fantasy books is probably part of your sacred Sunday as well.
Oh yes.
I'm just dying to know. I mean, Maddie, you're a newer person that I'm meeting, and so I have so many questions. Just to kind of kick things off, I want to know what got you into this field.
Yeah. So it's been a long journey. For those of you who don't know, to get a clinical psychology PhD, it's usually like 5 years of grad school plus years of clinical internship plus postdoc fellowship. So it's quite the time. And I was in college trying to figure it out just like everybody else. For a long time, I thought I was going to be a lawyer. Um, I look back on that like, what was I doing? And
You don't give lawyer energy.
exactly, I don't even enjoy conflict.
Was your lawyer dream influenced by Legally Blonde in any way, shape, or form?
Oh my gosh. The snap cup. I mean, I just wanted to like have snap cups and have my best life. So,
I totally wanted to be a lawyer when I was younger because of Legally Blonde. I think it was like a fleeting dream.
I
like
had a
that and the dream's gone.
Yep,
I had a
yep.
similar dream, but then I found out that the test taking for I went to
Mm.
University of San Diego, and they have a big law school, and I found out that the way that they test you is they give you like one little sheet of paper for like an entire semester of the thing, and I'm like major test fear type person, and I was like, oh no, I certainly can't do that. Like I certainly don't remember anything on day one on the last day of school, you know?
Wow.
Yeah.
Yeah,
That's a weed
no.
out just right there. So yeah, anyways, I did want to be a lawyer and then I was just trying to figure it out because that wasn't sparking joy at all. And I really liked my psychology classes and my sociology classes. And to get really sort of into psychology, you start to work in different labs to try to figure out what research you like to do and all this stuff. So you interview with different professors and try to get like a position in their lab. And I remember interviewing with the eating disorder professor at Drexel and her just being like so passionate about the fact that there's no really good treatments for eating disorders. Like there's 30%
Mm.
of patients who really don't, get better. Um, and that really shocked me because I'm like, we don't have that. Like, what do you mean we don't have
Yeah.
good treatments for these things that are so harmful?
Right.
And
And
so
so
that's how I
constant,
got
like
there.
so prevalent too.
Yeah, so prevalent. And so, yeah, I ended up just like joining her lab and then remaining passionate about like all of that. So that's kind of how I got there. I did that in undergrad and then applied for my PhD program and then just kind of continued my research.
Was there like a defining moment where you were like, okay, law is not for me. I'm going full steam into this?
Um, well, yes, because I wanted to do international law. So I was taking like a bunch of international relations courses and then realized I didn't care about it at all. And no matter what I did, I just couldn't get it right with that. And so it was like, okay, we've got to pivot. This is so stressful. And then also just finding that I really loved like the research I was doing in my lab at the time. And so it was just kind of like a happy accident, I guess.
Yeah.
When you were growing up and then like through your academic experience, did you have any knowledge about nutrition or exercise, or where did that like interest
Mm-hmm.
happen for you?
Yeah, so I've been a lifelong athlete in a couple different ways. I played volleyball in high school, and then stopped in college, and it was kind of strange to stop your sport that you'd been playing since middle school.
Your identity
Um,
changes.
yeah, it's just, what are we doing? Where's the structure? Where's my team?
Mhm.
And then I started to get interested in running marathons, and that was the first time I really thought about nutrition and exercise in that way, because it was all about like, a lot of people I was running with in my running groups were running to like lose weight, or, doing this marathon as a way to change their body or their fitness. And a lot of the coaches we were running with were like, actually, you might gain weight while you're doing this because you need to fuel yourself properly. And it was like such a interesting dichotomy that it kind of got me interested in how like athletics and all of that kind of plays into eating disorders.
Yeah.
So
It's
that's
so
kind of.
confusing, right? It's like, let's fuel for
Mhm.
performance, but the type of performance I'm doing kind of as a means to lose weight. But
Yeah.
then do I want to be good at this thing and get pride from it? Because that's what the athlete identity would do. But
Yeah.
then there's the other side where it's like, oh, I'm fitting into the societal norm, or like I have this pressure of trying to look a certain way. But then you're telling me to do the opposite of what I've been told. And like
Yeah.
again, that's where so many women who listen to this podcast find themselves. And so I'm really excited that you are here.
So, you work closely with individuals struggling with disordered eating, but many of us exist somewhere on the spectrum between health focus and sometimes too far. I think both Brie and I can honestly say that we've dipped into the space where we thought we were being disciplined, but it was really just masking for anxiety or a sense of control or whatever it was. I know for me, like I've said this example in actually our past episode about alcohol and drinking, where I was giving up my social time to go out with friends and I gave up drinking in favor of going to the gym on Saturday nights. And that's where I would spend my time. So I was isolating
Mhm.
and trying to control everything that I could control, which ended up slipping in the opposite way from what I wanted.
Yeah. Yeah. I mean, this has been a question on my mind for maybe most of my adult life is just like, where do we fall on the spectrum? And, are there seasons to the spectrum as well? Right. Because my mental health can ebb and flow. And then also my relationship with food, like that pattern can ebb and flow. And so, when you find yourself in this very like lonely and kind of scary spot for me, like binge eating has been something that's been a tough thing where I'm like, trying to be good during the day. And then the nighttime gets there. And then the little hunger goblin's like, we're still hungry and we want the good stuff now. And
Yeah.
so, being a coach, I'm lucky that I am excited about this stuff. I research this stuff, but I still get stuck too. It's like, oh man, like I could have a nice dinner of ground beef and rice and broccoli and all the things. But I'm like, no, I want the ice cream. And so then maybe the next day I'll train an extra hour or two or do an extra cardio session because I got to burn off the thing. And even
Mhm.
as a fitness coach, someone who coaches other people, sometimes it's scary to be like, man, I struggle with these things too.
What are some of like the early signs or subtle traits that someone might hopefully be able to acknowledge that they're developing like maladaptive habits around food or exercise?
Yeah, and I mean, I think everything is going to exist on a spectrum, right? So I work on the inpatient unit where individuals are struggling with like severe malnutrition. And, on the other side of that, maybe some early warning signs are starting to notice if you feel anxious, if you miss a workout, or if you're eating differently than planned. I think like a really good example of this might be someone, you work in person in office and someone brings treats and you're like, oh, I really want to have that donut today. And then, you have the donut, or maybe it's that decision in your mind of like, do I have this? Do I not have this? This is bringing up a lot of feelings for me about this donut. And then if I ate the donut, what am I feeling after that? And if you're thinking about that for hours and hours and hours after you had that sort of
Mm,
like impromptu office snack, those are like maybe some warning signs. Doesn't have to be about donuts, but it could just be, broadly that you're starting to feel a little bit anxious if something goes maybe differently than you planned.
yeah. So
Totally.
that, like, rumination factor of, like, "Oof, I
Hmm.
just cannot let it go." Whether
Yeah.
you do it or you don't, you're just in this, like, weighing game, and
Yeah.
the mental gymnastics is so taxing. Like, it's so draining.
So draining.
Are there any other common, like, patterns or thought patterns or behaviors,
Yeah.
that do often fly under the radar that might be something that signal we should look under the hood and see if there's something deeper going on?
Yeah, I mean, I think in general, it's just looking at your level of distress with things, right? So I know that a lot of people do track their food to reach fitness goals, and that can be really helpful. But then wondering if tracking is becoming controlling, right? So, if you go a day without tracking, how do you feel? If you can't log this breakfast, how are you feeling? In addition to thought patterns of, if I don't do something, I failed, or if I do something, I failed. So, like, if I don't hit this workout today, I'm, failing myself, or I don't deserve to eat, sort of those patterns. And even just thinking about like having to earn food or earn rest. Um,
Mm,
those are some things that, I think can be normative to some extent, right? Like people can have fitness goals and it can be important to get to the gym, and when it becomes to the point where you're skipping a day and then beating yourself up for it for hours afterwards, or even into the next day, or even adjusting how you're eating because of that, those might be some question marks to kind of start thinking about, hey, is this taking in more brain space than I want it to?
yeah.
Yep.
How do you get clients or patients to, like, self-assess? Like, how do you bring awareness, like, whether it's, like, a series of questions or a questionnaire, like, if you're treating a patient, how do you determine their risk for disordered eating?
Yeah, yeah. I mean, that can be really tough because it's a really vulnerable thing to talk about.
Yeah.
And I think a lot of the times, right, unfortunately, society has normalized so much of what we would actually consider disordered eating or eating disordered, that, maybe if you're not bringing it up in like this curious, compassionate way, it could feel almost like you're judging, or they have to defend why they're doing something, right?
Yeah, yeah,
So I really try to assess like, how much time is this taking up in your day? Whether it's your exercise routine, whether it's thinking about your food, whether it's thinking about your body, like how much time are you spending thinking about these things? Um, in addition to, is it getting in the way of your life? Are you turning down social plans because you don't want to eat out? Are
yeah.
you not dating because you're, not feeling like good about your body, or dating in and of itself is usually a very eating centered thing. So those are some of the things that, might kind of indicate, hey, this is beyond what might we would want to consider normal, right? So those are some of the things that I would try to get at when talking to someone.
It's really
Yeah.
interesting that you do speak about like earning rest, because so much of disordered eating or anorexia or these disorders is like about the food part.
Yeah.
And I think it's refreshing to hear you talk about the other side of like the energy balance equation with movement. And, we've been fed so much information like move more, eat less, portions, carbs are bad. And it's like we're all in this swirl of information, and it's so hard to figure out what's right and what's wrong. And so,
Yeah.
um, I'm curious if you have, any, like, are there any other things around like overtraining or under
Mhm.
resting, like things that you could share with us that you see?
Yeah, I mean, so the way I really try to think about exercise too is that I don't really care what you're doing, or even really how much you're doing of it. Yeah, I care about the thought process behind your exercise
Mhm.
behaviors. So, you could tell me you're training for a marathon and running 30 miles a week and doing all this stuff because you're training for your marathon. You could also tell me that I'm running 30 miles a week because I cannot not run 6 miles Monday through Friday. And if I skip a workout or if I skip my run, then I feel very anxious on the inside. I feel like bad about myself. So I really try to take it from a cognitive space, right?
Yeah.
It's all about why you're doing the exercise and um, why you feel pushed to do it versus even what you're doing. So I think about that a lot too.
Yeah.
Yeah.
So at what point it's sounding like a lot of it is like rumination. So assuming that most people can identify like, "Oh, I'm being a little weird." When can someone identify like I need to get a professional? I need professional help.
I mean, I think that's going to be different for everybody in some ways. Um, I think if you start to really feel yourself becoming completely preoccupied, you cannot, you're thinking about what your next meal is going to be, how you are going to incorporate your workout. If that's taking up, I would say more than like 10% of your brain space on a day-to-day basis, like I think it can change depending on who you are as a person and what your goals are. I think it's going to be different if you're training for something or, you know,
Bree, are you questioning how much you think about food?
Wow, wow, wow. You
you
guys didn't see this on the recording here, but she said 10% of your thought pattern should be about your body and your food, and
You're
I
like,
said, "Wow." I
"What
said,
if I think about food all the time?"
"Big WOW on that one." Yeah, I think about food and body image probably most of the time.
Yeah,
Yeah. That's so interesting to think
yeah.
about. It's like I love that you painted it as it's like I really don't care what you're doing. It's a matter of, like, how you're making that decision and how you're arriving at it, and I think that is I mean, that's the whole episode, that's the whole podcast is, like, the nuance of things, and I think that's so impactful, like, even as coaches, Kelsey and I can even look at, like, how we ask questions too. It's like, "Okay, what's your current training routine?" "Alright, well, why are you doing that routine? How did you choose that
Mhm.
routine? Who told you that routine was probably good? Was it someone who had a perfect body, or is it someone who is performing in the way that you want to?" So, I
Mhm.
really appreciate that, yeah.
Yeah,
And
and
we're now evaluating our food noise.
As we all should be on this podcast. I think it's a good dose of reality,
yeah.
I
because
will
we
be eating dinner and I'm like, "I can't wait to have dessert."
yeah,
Yeah, and I mean, like, there's some of that that's so normative, right? Like, there's
Yeah,
nothing wrong with wanting a sweet treat at the end of the day. It's just more about
sometimes.
if you're feeling, like, paralyzed by these things, you know?
Right, right. Yeah, I've
what
definitely gone through a phase where when I was just getting into nutrition and learning about my own diet, because I have a history of like having a really hard time gaining muscle and just
Mhm.
weight in general. And so I spent a long time trying to get myself to eat more of the right foods because I was like, oh, I can survive off one Easy Mac a day, no problem. And it wasn't necessarily from a disordered place. I just had no nutrition education. And so the pendulum swung the other way, and I spent like a year or more tracking religiously. And it
Mhm.
Mhm.
became obsessive where I was like, I can't eat a meal that I can't track. I can't go
Right.
out to eat. I
Yeah.
can't, it has to be chicken seasoned with like whatever approved seasoning I was doing, plain vegetables, no butter, no oil. Like it was misery. Like, and that's
Yeah.
what I think people think that health is
Yeah,
when tracking can be used as a tool, not a rule,
Mhm.
as a way to audit yourself, to discover features of a diet that help you reach your goals.
Mhm.
and also I think tracking can be helpful to make sure you're eating enough. I think,
Yes.
again, like you said, things are so normative, like, "Ooh, I don't deserve this cookie. I don't deserve this cheeseburger. Cheeseburgers are bad." It's like, well, it's normative to think that, but it's actually not true, and some people are like, "Oh, being healthy means chicken and rice." It's like, no, may actually be disordered eating you think that you want, and you're healthy for not wanting that, in fact.
Yes. Yes.
You're a normal functioning person for
Yeah,
not
you're
wanting
normal
plain
for
chicken
not
and rice.
wanting yeah,
Yeah,
tilapia and
this, like,
rice.
flavorless meal doesn't sound appealing to you? Like,
Yeah.
Crazy.
that's probably a good sign.
Yeah,
Yeah, and
right.
that is another big piece, like, your body knows what it needs to heal,
Yeah.
to be fueled, like, these hormones are so powerful, and, the
Mhm.
education, whether it's misinformation or not, is really powerful, and so what do you do when, like, you have somebody there and they're like, "Okay, um, I I eat really good during the day, and then I go all out at night." What are some questions you would ask, to get more information?
First, I'd probably try to really ask them, like, what their whole day of eating looks like, you know? And I am by no means a dietitian, but I can kinda get a sense if someone's restricting during the day, right? They're not eating enough, and then I would also just try to provide some education. I think that that's, like, a perfect point of education about, like, the binge restrict cycle, and why your body is doing that, to kind of also maybe reduce, like, any amount of shame that someone might feel, because I think
Mm,
binge eating can be so personal and, can feel very shameful to talk about sometimes. It shouldn't be. I don't believe that way. And I think that it just can be hard to talk about. So, educating someone as to why their body might be doing that, right? If you're restricting so much during the day to where your body's like, I just need to eat, I just need to get these calories in, it's truly a scientifically based cycle. There's nothing broken or wrong with you. Your body's just trying to get what it needs. And
mm,
starting from that place of, like, education, and then hopefully a place where we could then work towards spreading out our nutrition so that doesn't happen at the end of the day, because that's likely a sign that you might be underfueled, or that you're mentally restricting so much. So you
mm.
might not be nutritionally underfueled, but maybe you're eating all those boring things all the time, like chicken and
Or you're
rice.
or you're constantly saying like, "Oh, I can't eat carbs. I can't have
Exactly.
sugar. I can't have fruit because
Exactly.
that sugar is bad for some reason." It's all of
Hmm.
these little, like, ball and chains you have for different food groups. It's like, what if everything has a place,
Yeah.
but you were just more knowledgeable about all the places that it can go and should
Mhm,
go in order to
mhm.
help you along your journey? I
Yeah.
think that we see a lot of clients fall into that all or nothing trap where it's like,
Yeah,
I am all in chicken and rice every single day, or I'm binging on everything and I'm having
Right.
sugar, I'm drinking, I'm doing all the things. And then they feel this guilt and shame spiral.
Yeah.
yeah.
So sometimes I've had clients like even struggle, like when they do their consultations with me, they're like, I don't want to talk about nutrition at all. Like, I
Yeah.
have a history of disordered eating. I don't want to talk about it. That's fine. We don't have to talk about it right away.
Mhm.
Um, so on that note, I know that you've done a lot of research on the risk factors of someone who might experience disordered eating. Who are the people that are most at risk?
Yeah. These, I mean, I've done some research personally in more of, like, the athletic identity, exercise identity space that I can speak to.
Great.
Um, but broadly, individuals who are just more at risk to have eating disorders are the type of people who are typically high achieving, perfectionistic. Um, a lot of the times, they're the people who are going to follow the rules, right?
Mm,
And when I'm explaining this to parents, I always try to say, like, these are good traits. They've just gone a little bit bad right now, like, you've just taken them and kind of put yourself on a path that's maybe not the most helpful for you at this moment in time.
Mhm.
Um, but those things that make someone likely to have an eating disorder, also what's going to make you likely to be really successful in other parts of your life.
yep.
So I think those are kind of the key types and traits that we see, more broadly with who's at risk for developing these behaviors.
And I'm
Mm.
sure there's some like cultural and social media pressure that plays into the risk as well, right?
Oh yeah, I mean, it's so hard because social media is an ever moving target, but there are some studies out there that, like, if you sort of engage with eating disordered content, it's just going to push you more eating disorder content.
Right. Your
Mhm.
nervous system is just filled with all of like, your subconscious is filled with it.
Yeah, and that's just so unhelpful, right? So I think these like broad, things that people are exposed to are just making it even more pressure.
Yeah.
Right. Yeah. I think a lot of the social media fitness culture, like always wanting to be healthy, do this 75 hard, try this
Mhm.
trend, try this diet, feeds into the disordered patterns.
Because of
Mhm.
the all
Or
or nothing part. It's like,
Yeah.
right,
when you do 75 hard, that's what you're doing. You're
Mhm.
not doing much else because it crowds out time for everything else, which
right,
to its credit does a great job of it, but to its discredit, what do you do on the 76th day? Or what do
Exactly.
you do on the 10th day when now you feel like an absolute failure, but you just logged 9 days of amazing work, but you're so mad about that 10th day that you don't even do the next, 50. It's like,
right,
that's so tough.
Mhm.
right. It's so restrictive. Like, why can't we just roll with the punches and like go, yep, okay, missed one.
Yeah. And there is
It's
something about that, like, society does really reward, like, the consistent, like, hard, like, do it, and it's, like, amazing that you can do it, no one else can. It's, like,
right.
these amazing feats. It's, like, if you eat protein for most days, I'm really psyched. If
Totally.
you if you also ate a perfectly macroed meal every meal, I'm, like, "Nice, I'm just as excited for you."
Yeah. Yeah, and I think
Interesting.
we really reward things that might not always be the things that we need to be rewarding, right? So a lot of kids that I see come into the hospital are kids who might have been of a higher weight status, who are told by their PCP to lose weight. They start to try to lose weight. They don't really know what they're doing. They're just trying their best. They reduce portions, all these things, and they end up in the hospital because they've taken it so far the other way. And sometimes it gets missed for a while because that weight loss is praised and it's seen as like
Mm,
this really good thing, but no one's really questioning, are you doing this in a way that's sustainable for your body? Is your body okay? So I totally think that we sometimes just place the value on maybe the things that aren't most helpful.
and it's the outcomes. It's placing
Yeah.
emphasis on the outcome and not the inputs, and
Yeah.
with clients, I do consciously hold back on, like, even, like, celebrating PRs sometimes. Like,
Mm.
I won't say, like, "Great job on your 300-pound deadlift." I'm like, "Man, you did so many deadlift days this year. Like, you totally earned that PR. Like, look at all that hard work you just did." And I
Yeah.
think, like you were saying, a lot of, at least for me as a kid, like, it was like, "Good job winning that race. Good job turning in that paper." It's not like, good job reprioritizing your busy schedule to make time. It's like, it's just not that way. And
Yeah.
so then as adults, we feel like we get less and less opportunities for praise, right? We rely on like
Mhm.
school and parents and school sports, but then when you're like a 35-year-old adult with kids and you're like, no one gives me a pat on the back for shit.
You
And
can't even celebrate yourself
I can't
because you
even
don't know
celebrate
how.
myself. In fact, I'm mad that the thing that I should be celebrating that I didn't do it better.
Yeah.
That's
I
35.
know.
That's 35.
That's 35. I'm like,
Maybe
can we
not
just
even
be happy I got out of bed today, you know?
Yes.
Yes, let's celebrate
Yes.
that.
Yeah. This might be a little abstract and I'm totally going off script here, but like
Let's do it.
where do you feel like things went wrong in like the way that our culture views body image and food? This doesn't have to be related to like you, Dr. Maddie. This can be
Yeah,
just us gabbing about where the fuck we went wrong.
I know. I truly don't know because you think about like all the Renaissance paintings and everyone's beautiful bodies are like celebrated
Even
and
Marilyn Monroe, like, she was
yeah,
even more recent than that too.
yeah.
What
I
happened?
blame the Puritans, I
I
think.
blame tuberculosis.
Oh, shit.
Everything's tuberculosis.
Wasting disease was glamorized. They were like
Mhm.
they literally in the 1800s were like, "You know what's hot?
Yeah.
Tuberculosis. Only the rich, the talented, they get tuberculosis. Everyone else that's colored, women, fuck them, they're dumb."
Yep. Yep. It's tuberculosis. I think it's like this um culture like valuing just depriving yourself, you know?
Right. Why do we do that?
The
'Cause
self-sacrifice, the martyr.
I know.
Like,
It's
oh,
not
you just
cute.
no.
It's like this like hardcore American way that's like we have personal responsibility, but we also don't. And we don't need the government.
Mhm.
So let's just do everything ourselves, but also just restrict everything and then you're solved. You're fixed.
Yeah,
Yeah.
just
Just
play
wither
it by
away.
the bootstraps, hard work, rub some dirt
Right.
in it.
You're not working hard enough if you're not shriveled away and have the most money out of everyone.
Yeah.
Like, where did we go wrong?
And like you were saying with
Mhm.
social media, the more exposure we get to it, the more we fixate on it and the further away from what's good we feel. And then it
Yeah.
probably perpetuates this cycle of like, I'm still not good enough. I'm trying to do all the things and that's not good enough. So then
Mm.
now I'm not good enough. And it becomes, again, less of a practice of what I'm trying to do to be a certain way. It's now I'm the problem and I suck. And then it's not even about like the inputs, it's just I suck.
Yeah.
Yeah. And I think
Yeah.
weight is like one of those ever changing targets. Like I always hear from patients, it's I had this goal weight, but once I got there, it still didn't feel like enough.
Yeah.
So it's just one of those ever sort of changing targets that you can continue to try to deprive yourself from.
That's
And
the
Kelsey,
thing about aesthetics or weight is,
yes.
like, the
Yeah,
goalpost is always moving.
that's exactly right. Yeah.
I remember when I, like, first started working out and I was like, "I really want abs, like, that would be so cool." And then, like, I kinda got abs and I was like, "Oh, it's not as cool as I thought." I want, like, bigger shoulders. I want a
Yeah.
big butt. I want huge quads. Like, I want all these things, and it was never like, "Wow, I did this thing that I, like, set out to do." It was always like, "Next thing, next thing, next
Yeah.
thing, next thing." And kinda like you were saying, Brie, like, we never stop to celebrate
Mm-mm.
the
No.
small micro achievements.
No, and it's like that's why I focus a lot less on progress, like photos and weight and all this stuff.
Same.
It's like because again, that's a moving target. You're never going to actually be satisfied. When you get to
Mhm.
the magical 15% body fat you want to be, you're now
Which isn't
hitting
realistic.
which isn't realistic and not healthy. It's outside of health spectrum
Yeah.
for women. And I also think that like you said before, Maddie, it's like it speaks to it's so great that you have all this energy to put into making yourself better. You think that these things that you're doing and all this energy that you're putting forth is good, where in reality it may be killing you. But
Yeah.
what if you put that energy and effort towards something that like actually was like positive, like performance and all the other different ways we can look at fitness? Because the other part is like Kelsey and I have seen this so many times where someone's like, oh, I'm still 150 pounds. I'm still, but then you see their body composition changing. You're seeing the
Right.
contour of their muscle. Like 150 pounds looks so different on two different people from height, weight, whatever, but also on your own body, 150 pounds looks different.
Yep.
Mhm.
You know, it really makes them like it could be two pant sizes difference and you're still the same body weight.
Yeah. And it's like, how do you feel within that? And what are you achieving? Like those sort of like more objective measures of health, right? Like, what do your labs say? How does your bone density doing? All that stuff
Yep.
could be very, very different in that same sort of weight, right?
There's
It'll
so many more effective, valuable data points that we have that are not the scale or the
Yeah.
way that you physically look. Like, yeah, we all wanna look a certain way, we wanna feel good in our bodies, but what if that was just, like, the least important thing about you? Like, that
Hmm.
can be valuable, sure, we all wanna feel good, but there are other things, like how strong you are, how mobile you're gonna be into your 60s and 70s and 80s.
Yeah.
Yeah.
Maybe this is just us getting older.
I
I
don't know.
know.
Well, I actually do get a little bit worried for like the younger generation who has access to GLP-1s, where
Yeah.
for us, it was like, there's no magic pill. That's all. Now there's a magic pill, and there's so many health risks for uneducated
Yeah.
people taking it. And I
Yeah.
work in a medical facility where they bring them samples like candy. I go walk in the back and grab some Manjaro, and I'm good to go. But it's like, it's everywhere. And so one thing I'm curious to see, like you were saying, bone density is a huge piece. Muscle mass is a huge piece. Those are the biggest determiners of longevity. And I'm really scared for this younger generation who doesn't know and can get it like candy. And then you have us who have like seen the Atkins, the Weight Watchers, the almond moms, all this stuff. And
Mhm.
we're confused too. So who's going to lead us? Right.
Yeah, I do also really worry about all the GLP-1s, and there's just like such limited research and such limited understanding of all of that. And
So, have you seen a lot of GLP-1s in your unit yet, or, like, people with disordered eating using?
What age do they give GLP-1s?
I feel like I think I don't know if you could get it as a child. Like, I think for medical things that they could probably use it as a maybe 16 or something, but don't quote me on that. But because I do work with mostly like adolescents, they're not having access to these.
Yeah.
Um,
Good.
it's rare that we see someone who's like on a GLP-1. Um, I just attended a conference not that long ago, and one of like the hot talks that everybody wanted to go to was GLP-1s and eating disorders.
Mm-hmm.
And they were kind of talking about from a medical management side of like you have a client who's using a GLP-1 maybe because they are of a higher weight status, but then they want to continue to take it too far, and how to have
Mhm.
those compassionate conversations about backing off and saying no, like this is a weight that your body needs to stay at, or this is a weight that's good for you, you don't need to lose any more weight. So I think the conversation right now is more of like even GLP-1s, using them too much, and then getting sort of chasing that goalpost, right? Of just
Mm-hmm.
wanting to continue to lose more, and that can be disordered in its own way.
And
Yeah.
you see the scale go down and down and down and down, and you're like, "Ooh,
Yeah,
I'm doing better and better and better and better," and it's an inside job.
yeah.
No
I'm
one's calling you out.
worthy.
Yeah.
Hmm.
What I'm doing is working. I'm seeing results. They're numbers. You can't fuck with them. They're numbers.
Right.
You
Yeah.
can fuck with photos and the way jeans fit and how your brain sees your body, but yeah.
The
I'm
numbers are objective and can be addicting, even if not helpful.
Yeah.
yeah. Yeah.
What does treatment for disordered eating look like, and how successful is it typically?
Yeah. So the most effective treatment is called family based therapy, where parents are really learning and taking on the role of like the primary feeder. So they are plating every meal. Everybody is sitting for like meals and snacks. A lot of it starts with just nutritional rehabilitation, especially for individuals who are medically compromised, right? Like the goal is just to get your body more nutrition, because sometimes I'm even seeing people who are such a low percentage of a treatment goal weight that they can't really cognitively participate in therapy at that point. They really just need to sort of get more nutrition first, and then it starts to work on how to cope with urges, how to cope with wanting to restrict or binge or purge, and using other skills for that, right? Like how can I cope with these um, urges? I use a lot of deep breathing, a lot of opposite action sometimes as a favorite skill of mine to teach, where it's basically just like you do the opposite thing of what your body's wanting you to do and what your brain
Mm.
wants you to do.
What's an
um,
example of that you would use in practice?
yeah, so let's say you are waking up and today maybe you don't feel that great about your body, and you're like, you know what, I'm just not happy with myself, I'm gonna skip breakfast and kind of just go through the day. And literally the opposite action would be, I am going to make a breakfast, whatever that might look like, because I am countering my urges, right? So I don't care what your breakfast is. If you're making something healthy, not so nutrient dense, whatever it might be, you're countering the urge to restrict, and that's the win. And you do that enough times with all these different urges, and over time you learn to kind of be able to say, I did the thing that's scary and things were okay. It
Mm.
might have been really hard in the moment, it might have been hard after the moment, but things were okay. And then ultimately working towards a life worth living that doesn't include disordered eating, and identifying what is important to you besides your eating disorder. So
Right.
kind of take steps by steps.
Love
And you
that.
did mention earlier that 30%, or at least at that time, is what did you use that statistic again?
Yeah, yeah, yeah. So about like 30% of eating disorders persist chronically,
Mm.
where they're not successful in treatment. Um, and I'd love for that statistic to go down one day, but I think that that's like such the hard thing about these disorders, is that they're so intact with who you are a lot of the times. People don't want to give up their eating disorder. It feels good. It feels
Mm.
like it's helping them achieve their goals, and getting to the other side of realizing, man, I was running my life with these food rules or these exercise rules, and being on the other side of not having to have that space to think about those things, but it's really hard. And what my patients are doing and what people who are recovering is not easy.
Yeah. Yeah. And I think we're like often creatures of our like conditioning, right? Like the things that you
Mhm.
do all the time are easy and it takes a lot of work to change the behavior. So if what you already do tends to be a little disordered, you're going to naturally fall into those patterns until you try to do something differently. And if
Yeah.
you don't have like the outside objective resources to help you, like nutrition education or a coach or a psychologist, like you're just going to be stuck because you don't know and you're going to be paralyzed.
Yeah.
So talked a lot about like what are the signs of like disordered eating.
Mhm.
Can you speak to any of the signs of like a healthy relationship to food or exercise?
Yeah, of course. I think the biggest thing when I think about having like that healthy adaptive relationship is just about being able to be flexible. um, your best friend texts you and is like, I need a happy hour now. And you're like, well, I was going to go to the gym tonight or whatever, but you want to support your friend. You're like, yeah, I'll go. That doesn't have to happen all the time, but it's the type of thing where you're not necessarily saying no or being distressed by these sort of impromptu things. um, skipping a workout when your body's in pain. I think that that's actually the healthiest thing you can do versus, I'm going to be in pain and push through this workout anyways. That's not necessarily the best thing for you. So I think, it all comes down to just how can you adapt and incorporate change, and every week might look different, but it's just about having that like flexible perspective on food and movement.
I love that.
I do too. And so a lot of what we're hearing is like too much of a good thing can be a bad thing, right? The dose is the poison. We talk about this a lot. And the dose sometimes, I think what you said that hit me the most is the intentionality behind it. Like if someone's listening to this and like, where am I on the spectrum? It's like, well, like study your decision making process
Hmm.
and specifically around food, specifically around movement. I like how you talked about rest because even though, um, talk about like resting from workouts, like sometimes depriving yourself of sleep because you have to do more work or there's more things to do. It's like that trickles down into food, that trickles down into self-care. And I think when we when we consider what food is, it's fuel, it's like self-love, there's, culture associated, there's connection associated. There's so much part of food, which is amazing, but it's also really scary for someone who like you said, maybe they really like their eating disorder and it serves them in some way. And even just facing like, oh, the treatment means I have to do exactly the opposite of what I was doing. That's scary.
It is
So I
scary.
Yeah, and I really just appreciate how you shared um that it's just going to be a journey. Like you're not maybe going to be fully healed, but it's like always going to be one decision, one decision, one decision at a time.
Yeah, and just trusting yourself enough to know, the freedom and allowing yourself flexibility doesn't mean you're not caring about yourself. It actually means that you're doing the best thing for yourself by just kind of trusting those decisions.
Yeah.
Yeah.
So let's say someone's listening and realizing that they might have some of these traits.
Hmm.
What can they do about it? What are some practical grounding or self check in strategies you can recommend if they notice some dysregulated behaviors or thoughts?
Yeah. So if you notice those thoughts coming up, I mean, one of the things you could practice, like I talked about earlier, is just that opposite action. So doing the opposite of those thoughts, whether it's I need to push myself to the gym today because I want to look a certain way or because this is the only way I can have my sweet treat tonight. Maybe don't go to the gym and also have your sweet treat, kind of do both of those things. I also really believe in the practice of body neutrality. We talk a lot about body positivity or body negativity, but sometimes with body neutrality, it just means your body's not the most interesting or most important thing about you. So maybe it's I wake up and I'm like, ugh, I don't like feel my best today in my body, but that's not going to change anything I do about the day. I'm not going to eat any different. I'm not going to exercise any different. I'm not going to change who I talk to or what I do with my day. It's just there. And I think sometimes it can be really hard to fall into that trap of I have to feel good about myself all the time. It's okay if you don't. You just don't let it kind of go into that spiral. If you can just remain neutral about these things,
When
it
it
can
starts
be a really
adjusting your
helpful practice.
behavior.
Yeah,
Yeah.
exactly.
Yeah.
Um, and I think I really do want to plug though, if you're noticing a lot of these things come up in feelings, talk to a therapist. Look into someone who works with eating disorders. Psychology Today is going to be your best friend in terms of trying to find someone who specializes in these things. And
That's good to know.
um, yeah, there's no shame in opening up with someone. Therapy does not have to be forever. When I see my patients, I'm like, I want you to leave. I want you to go on with your life. It's not something that's forever, and it doesn't mean there's anything wrong. It just means you're trying to seek some support.
And education. I think a big
Yeah.
part of, like, what you said is educating of, like, okay, this is a behavior or a pattern that's happening. Let's look at why it's happening. Maybe it's
Yeah.
largely biological and not psychological. I mean, sure, there's always gonna be that component. Both can be there, but
Yeah.
maybe just telling someone like, "Hey, these binge cravings are actually just your body asking for more food." And so if we give it just a little bit more food at an appropriate timing, the intensity of how crazy this craving is going to be lower, and maybe your ability to dismiss it or make a better action is there, and just giving someone that tool sounds like freedom.
Yeah,
I
absolutely.
want to ask this last thing because I feel like we have a lot of like noise around like the things that we can do for ourselves. I want to ask if someone is worried about their friend, they
Mm.
notice some patterns, what's a compassionate way to check in or offer support? Like that's not going to like create that defense.
Yeah, that's really hard because these things are just gonna get people's defenses up. I think the best way is again, like you said, like leading with compassion. It could be just like, hey, I noticed you seem a little bit stressed about your food routine or your exercise routine lately. Are you okay? I noticed you've been saying no to a lot of like drinks with us or meals with us, or just kind of observing like behavior pattern. And just coming from a place where it's like, I really care about you and I just want you to be okay, and if you're not, I'm here for you. And if you want to leave it there, that's also okay. I think sometimes I take the approach of plant a seed and walk away. It's
Mhm.
I'm planting the seed that I'm worried and I love you and I notice these changes, and there's nothing more we have to talk about today.
I love
There.
that.
I love that. That's good to know. And just to summarize again, what we're hearing is too much of a good thing can be a bad thing. So whether it's exercise, it's clean eating, tracking everything, or even just feeling disciplined, when those tools stop serving you and start controlling you, that's when it's time to check in. Freedom is the goal.
Maddie, thank you so much for sharing your insight with us and breaking down something that can feel so heavy in such a compassionate and grounded way. I definitely feel lighter. What's one message you would like listeners to take away about creating a healthy relationship with food and movement?
Yeah, I think, we've been weaving this throughout the whole time, but I really want to say, healthy movement, eating, it's not about control. It's about being able to be flexible with yourself. And I think that's the most loving thing you can do for yourself, is allowing that flexibility and trust. And the goal is, to live a life that feels full and maybe not perfect.
And for the listeners who have been with us, the auto regulation episode would be a great refresher, because that's essentially what we're saying. And I actually had just had to like make that switch in my brain just now of like, be flexible. I'm like, well, what about all the clients who are like, wait, no, you tell me to get 10,000 steps every day. It's like, well, yes, that's the goal, but it's like you can auto regulate if you're feeling a little bit tired or you're feeling run
Yeah.
down, getting 10,000 steps to overstress yourself and make yourself unhappy. We're not saying that. We want you to auto regulate. Maddie's saying give yourself a little bit of grace. So I think we're all on the same page there. And if this episode helped you feel seen or heard, or maybe even had a reality check that you needed, myself included, share this with a friend. And as always, connect with us on Instagram at overt_thinking podcast, at Brianna Lamb, and at Kelsey Michelle. And you can email Maddie if you have any follow-up questions for her. We'll put it in the show notes as well. Thank you, Maddie. And we will see you in the next
episode.
episode.